And digging deeper into the issue tonight, the number of homeless deaths in Denver has spiked 50% compared to last year.
And those deaths are just one of the many reasons that Mayor Johnson declared a state of emergency.
Well, Denver 7's Jessica Porter in studio with us tonight. You talked to the medical examiner's office to find out what's behind these numbers.
Yeah, this is a really sad statistic here. The Denver office of the medical examiner started tracking a sharp increase in homeless deaths in December, and that hasn't slowed all year. This increase puts a strain on our hospitals and services.
Is this a public health crisis?
Definitely, without question, yeah.
So far this year, homeless deaths have spiked 50%. Last week, Mayor Mike Johnston said about 17 people had died on Denver streets since June. But that number is actually much higher when you account for the unhoused who died in places like hospitals.
That number actually speaks to deaths among people experiencing homelessness that occurred outside. The true number is actually quite a bit higher. It's in the range of 40 to 45 deaths that occurred in that period among people experiencing homelessness.
Epidemiologist Ethan Jamison tells me there are two causes behind the increase. The homeless population in Denver is growing, up 31% over last year, and the vast majority of unhoused deaths are from fentanyl overdoses.
We're seeing a lot of these deaths are not just due to fentanyl, they're due to a lot of different drugs on board. And so again, you're seeing kind of a cocktail of many different substances contributing.
The numbers are outpacing all previous years of tracking. 166 unhoused people have died so far this year compared to 108 last year.
Yeah, well, I think our death investigators who are out there every day on these scenes are definitely feeling the shift and seeing the increase in both drug-related deaths and deaths among people experiencing homelessness, kind of continuing through our whole office as well as our forensic pathologists, and just having to actually change our workflow and build up our workforce.
Fentanyl is not just a problem impacting the unhoused. The numbers are grim across the entire population. In the first 4 months of this year, there was a fentanyl death in Denver every 24 hours and an overdose every 15 hours.
And it's heartbreaking.
The Office of the Medical Examiner has not recorded a single homeless death from heat or exposure this year. All of their data is available online, and they hope the numbers help the city and other organizations find solutions. Reporting live in the studio, I'm Jessica Porter, Denver 7.
Staggering numbers, Jess. Thank you for that report. The Colorado Coalition for the Homeless can help with housing and healthcare services. You can go to their 2100 Broadway location for housing and rental-related assistance. Walk-in hours are Wednesdays between 8 a.m. and 2 p.m. And medical help is also available at a number of locations across Denver. And they will not deny service even if you can't pay. You can find a list of all those providers on their website, coloradocoalition.org.